Welcome to another episode of the Back to School Shootings podcast. My name is David Reedman. I'm the creator of the K through 12 school shooting database. And this is the podcast where experts in the school safety space, PhDs, physicians, people who have researched this topic for decades, come and share their unfiltered, unedited, unsponsored ideas about how we make schools safer across the country. And today, the guest is somebody who can do that as well as anyone in the country or the world. Dr. Brian Williams is the author of The Bodies Keep Coming, which is his personal stories about dealing with gun violence as a physician. He's a Harvard-educated physician. He was a congressional health policy advisor. He's a military veteran, and he's very passionate about this space. So, Dr. Brian Williams, thank you so much for coming to the show.
David, thank you for having me. I've been following your work for a while on Twitter. Great work there, and it's educated me, and I'm just pleased to be able to be part of the conversation.
Yes, I'd like to start with just how did you get into this space? I mean, you've had a really interesting career. You've been all over the world. What ultimately made you feel that you needed to write a book about gun violence, that you needed to be involved in stopping gun violence?
Yeah, I guess it's probably best to work backwards from the book because I didn't initially plan to become a doctor. It wasn't a childhood dream of mine. Even when I was in college, that wasn't my plan. I'm a proud graduate of the United States Air Force Academy. My major was aeronautical engineering, so I spent my time on active duty running classified test programs for the Air Force, and later decided to go to medical school and did the typical route: medical school, residency, fellowship training. And
let's pause there for 1 second, because we got to unpack this for a second. Okay. So I'm in Orlando. My house faces east. I see every launch from the Cape from my backyard. Absolutely incredible what's happened in the space industry over the last 30, 40 years. So you were in that. You were doing aeronautical engineering. Why in the world did you switch to medicine? Let's first unpack that for a second.
I get that question a lot, and back then people thought I'd lost my mind. It was a dramatic shift. I was on a really good trajectory as far as being a military officer in this career field, but it sounds cliche. It was just a calling to medicine, to be able to help people. A lot of my friends and my social circle were in healthcare, so I was exposed to their world through just socializing. And over the course of about 2 or 3 years, I was thinking about it in the back of my head that I wanted to make this shift. And then when I finally made the shift, I took the test, got into medical school, and I went to actually South Florida in Tampa, not very far from where you are right now. And it's been a great ride. And the important thing here is that all the work I'd done in the military actually prepared me to be a much better doctor. There are principles of leadership and teamwork and learning that I think apply no matter what we do in life.
And then, I mean, that's even unique the way that you talk about that in medicine, because obviously there's an enormous amount of time and resources that go into being a licensed physician, and then even a fellowship trained physician. I mean, you're putting more than a decade of your time into that. So a lot of people immediately look for private practice, look for kind of the most lucrative fields within that. There aren't a lot of people that end up doing direct patient care, doing emergency patient care. Kind of what drew you to being an acute provider?
Well, that's the great thing about healthcare is that there are so many different options, whether it's in academia, where I spent the entirety of my career, private practice, community practice, some going to industry. I wanted to help the most vulnerable populations. I've chosen to work at public hospitals. I was in Atlanta for a while, then in Dallas, south side of Chicago. So those that did not have insurance, did not have access to a regular doctor, those were my people. That's where I wanted to serve. On top of that, I was drawn to the field of trauma and acute care surgery because you get to take care of the sickest patients that come through the door. It's fast paced. Quick decisions have to be made, and I think that just aligned with my personality as a whole. So combining those two things, this desire to help the most vulnerable with this very high-paced, high-stress environment, what drew me to the world of acute, traumatic emergency surgery.
But then, of course, that's an exciting, fast-paced career, but it clearly takes a toll on people because you're seeing society through a different lens, through a different part of it than everyone else is. And I believe, your book is an expression of that because you have all of these experiences that you've internalized that really shape your views on society, on vulnerable people, on the things that need to be fixed, on preventable injuries that don't need to happen. So you put all of that into a book. And can you talk about that process and your decision that you wanted to take these highly personal experiences and put them out there for everybody to understand and share?
The way you describe that, David, I need to hire you as my PR person because you encapsulated that so perfectly. The book really, I tried to describe my evolution as a doctor, but also as a contributing member of society. From the early days of my career, where I was just excited to be in the OR, to teach residents and fellows, to care for my patients, and just being that high stress, fast paced environment. Then seeing how what I am seeing in the hospital is really just a barometer of what's happening in society, in the communities around me, right? What is it about the communities that I'm serving that leads to this conveyor belt of gunshot victims that are coming into the hospital, people who are coming in with late stage cancers, uncontrollable and preventable chronic diseases. There's only so much I could do in the hospital. There's something happening outside the walls that really needs to be addressed further upstream. So in the book, I wanted to teach you if you had no experience in the hospital, but I did not want it to be a lecture. I wanted to pull you into this world so that you are experiencing this and learning with me as we go along. And I came to the conclusion that, look, despite all my training, despite the patients I care for and the families, and I know this is noble, necessary work to make a change at a systemic level, at a structural level, required me to look beyond the confines of the work I was doing within the hospital. And that's what the journey of the book is about and how I move forward to try to make a bigger difference in society.
I think that's something that's kind of common across the people that are the advocates in this space, because you don't dedicate your time, your reputation, your life energy into dealing with this problem unless gun violence is something that is really personal to you, has really impacted you. I think an issue where a lot of people kind of idolize gun ownership because they've never witnessed firsthand the damage that guns have done. I mean, from when I was 16 years old, I was drawn to emergency services. Fortunately, I was able to volunteer in the fire department as soon as I was 16. And over the course of the 18 years that I served as a volunteer, I have been to quite a few gunshot calls. One that just stood out more than any of them was a call for just a regular chest pains. Get that all the time. That's probably the most common thing you see in the ER. It's the most common thing that an EMS unit's responding to. And we're assisting a chest pains patient in a second floor apartment, and you just hear boom right outside. Commotion outside, run downstairs. There's a garden apartment that kind of has a little park and playground in the center of it. And there's a teenager that had just been hit in the face with a shotgun. So there was a dispute. There was something going on there, and he had been shot point blank just a couple seconds earlier. You can never unsee and unexperience that profound physical trauma and emotional trauma to all the people that are there. And then that gun is not a toy anymore. That gun is not an object to to take a lot of pleasure in, because you've seen, like, in a second, somebody goes from being alive to somebody's gone. And you've seen that play out hundreds of times. Like, what is it that, was there a moment that made you feel like I need to do something other than being here, like a specific person, a specific patient, or was it just the accumulation of so much trauma?
It was a accumulation of what I'd seen in the hospital as a trauma surgeon. I've had members of my family taken due to gun violence. So it was personal and professional for me. But there was a moment when we had the mass shooting of police officers in July of 2016, and I was the trauma surgeon working that night. It was that moment where I was at a point in my life where I was thinking about what I could do more. That was when I said, okay, this is not working. I have to do more.
And unfortunately, like, there have been so many mass shootings that people might not remember what that shooting in Texas in 2016. Can you just kind of give the audience a reminder of what happened?
Absolutely. You have to take yourself back in time to 2016. There was another presidential election that was between Clinton and Trump that summer. But we also, that year, we had just a number of officer-involved shootings of Black men after routine stops. So on July 5th, Alton Sterling was shot and killed in Baton Rouge, Louisiana. July 6th was Philando Castile, which many people may remember because that was in Minnesota, and he was pulled over, shot in the driver's seat, and his girlfriend live streamed the death on Facebook Live at the time. So that generated a lot of national attention. So on July 7th, there were peaceful protests scheduled all across the country in response to those shootings to raise awareness of this. And also remember, just where you were in Orlando, a month prior to that was the Pulse nightclub mass shooting. So gun violence, policing, race, it was this cauldron that was just bubbling. On July 7th, the protest, but the one in Dallas, turned violent. There was a lone sniper there that was there intending to shoot police officers. He shot 14. 7 were brought to the hospital where I was working that night. I was on charge for the trauma team. 3 of them died. And it's a night I still think about. I still think about that day every day until now. And that was a moment where there was gun violence, policing, race was an issue. And afterwards, I decided, okay, do I go back to being what I was before, just doing the same thing day in and day out? Or do I step into another arena to try to make a bigger difference on a more systemic level, using my experience, my platform, my voice, and my credentials, really, to get people to listen and try to inspire people to be part of making change.
So that's 2016, and you just go home that night and you sat down, you just started punching out the chapters of the book. Like, let's talk about the evolution.
So I don't know how much time you have. That was a traumatic experience for me. Okay, I was a different person. Fortunately, my wife was there as a grounding force throughout this time. But for the days after, I just tuned out. I wasn't watching the news, not listening to the radio. It was a traumatic experience, and it was the dominant news story. So it was a constant trigger for me. I had this loop on in my head. And then a few days later, they wanted to have a press conference to talk about the event. I was asked to attend. I initially declined. I didn't want to be in front of cameras reliving this event. And we've seen how these go. There's a kind of a script you follow after these mass shootings. My wife, I told her, I said, I'm not going to go. She said, you're going to the press conference. You don't have a choice. You need to get over yourself. This is bigger than you. People are out there talking, Black Lives Matter, all lives matter, blue lives matter. They're saying that Black men are violent and deserve to die. And if you're not there, people will not know that the night that a Black sniper shot police officer, that there was a Black doctor trying to save their lives. So you have to be there to show up. So initially I went, just planning to sit there and be on camera until it was over. But eventually I did speak. And I talked about the things you and I have already been talking about. And that 2-minute clip of Beat speaking went viral. It was trending on Twitter. Around the world. It was listed as a top 10 media event by Huffington Post. Unplanned, but after that, everything changed for me. And then I went to therapy. Dave, there's a lot to talk about.
Mm-hmm.
And probably about a year later is when I began writing the book. Although I didn't see myself writing a book. I was just writing down my thoughts to kind of clear my head. And it became a book over the course of several years, not as a diary for you to read and be entertained, but I wanted to turn it into something that can be useful to you. Like, here's what I went through. Here's what I learned. Here's how you can use it now together. Let's go change the world.
Let's pause for a second and back up to, you have the press conference, but you've been profoundly impacted by this traumatic incident. And we don't spend a lot of time talking about what happens in those days and weeks and months after a traumatic incident. And that's something that children have experienced, something that teachers experience, the first responders that are there. We don't talk a lot about the physicians in the hospital, and then we don't talk about the people around the perimeter and the periphery of this. I had nightmares after Uvalde for a week, like waking up thinking I'm in that school because I was so close to it. I was doing so many interviews that you end up internalizing these things. And you start thinking that you personally are responsible for them, that you're responsible for the people who died, who they probably had no chance before they got to the hospital. But you have this incredible guilt. So can you talk about that period of months afterwards? Like, what did you need to do to get yourself back in a position to be able to help others because you were where you needed to be mentally?
For me to continue on that path of post-traumatic growth, and to be clear, there is no end date to that. I'm still on that trajectory. I do a lot of internal reflection. My wife, like, who's a superstar, like, she's really good about pulling these things out of me and have me look at myself, and also just agreeing to see a therapist, right? Just someone, they're professionals. They know what they're doing, right? I talk about this in the book, where when a patient comes into me that's critically injured and they can't speak for themselves, it is our job as a team to interpret the vitals and the injury pattern to do the right thing. I feel that when I sat down on the couch for the first time in front of my therapist, she had me made. Even though wasn't willing to share everything, like, she knew what was going to happen. She had it all laid out, and she's going to go through it the way she wanted to pull me through this this period of growth. And it was she who suggested, look, you need to go back to that night. Because I talked about everything else but the night of the shooting for a long time. And she said, just write a trauma narrative to yourself, what you saw, felt, smelled, heard, and start with that. And once I did that, that was the beginning of the path to healing, right? And that is a major theme I want to get through in the book. Was we talk about a lot of really devastating ends. It's about gun violence, it's about health inequity, it's about racial justice, but I want it to be hopeful, and it's about how we can all heal. We're not perfect, but we can strive for perfection when it comes to how we view ourselves and how we view our role in helping others. And I just want to kind of put that out there in the book. So when I tell people, you read the book, David, you know a lot more about me than I'll probably ever know about you, because it's all in there. It's all in there.
Which is a strange position to be in also, where you encounter people that know you intimately, but you've never met them. Like, for example, I didn't think it was going to go this way, but when I did the interview for Freakonomics Radio with Stephen Dubner, that turned into an hour-long interview about who I was, about how I got here, about what my childhood and adolescence and experiences with gun violence were. And then when I've met people later on who've heard it, all of a sudden they come up to me with these questions. It's like, it's so strange to have to let your personal thoughts out there, and then you encounter kind of people who know you better than you know yourself. That's a very, very
But
strange position to be
it's
in.
liberating, though, isn't it? Isn't it liberating? I mean, I felt liberated doing that, and I feel like you're helping people. You're helping people in a different way. It's not using my medical degree. It's you're helping people by connecting on the commonality of the human experience, and that
Right.
is so powerful.
And that's where I think a lot of people are right now who I talk to, especially parents, students who are in school. I get emails from high school kids, from undergrads who are just terrified of gun violence. I talk to teachers, and they all feel helpless. They feel like this problem is just spiraling faster and faster than they can keep up with. And they're just in a state of paralysis or fear or anxiety. Like, what can you say to them about moving forward, about taking action, about not accepting the status quo that we have right now?
Well, I'm very hopeful about where we are and where we're going because we've made such tremendous progress in the last few years. Just have to accept that this progress it may feel glacial, right? But we have to do the work now. They said the best time to plant a tree was a decade ago. The second best time to plant it is now, right? So we are planting our justice tree when it comes to ending the epidemic of gun violence. But just let's talk about what's happened in the past few years, okay? When I was a congressional health policy advisor, I worked in the office of Senator Chris Murphy, and it was during that time, after Uvalde, when we passed the Bipartisan Safer Communities Act, the most significant gun safety bill in a generation. The next year, the White House created the Office of Gun Violence Prevention. This year, Surgeon General has released a report declaring gun violence a public health
Epidemic.
crisis.
Yeah.
A few weeks ago, President Biden signed more executive orders on gun safety. So you can see it's happening at the policy level, but also the grassroots level. Like there's so many opportunities for people to get involved in doing what we can to create safer communities, create safer schools. Moms, grandmothers, it's crossing all racial and age demographics, as well as social economic demographics as well. So I feel very excited and hopeful because we're at a point now where you can kind of feel the critical mass is developing, where once you get moving, you cannot turn the clock back. So I agree that at times it may seem hopeless, but I'm very hopeful because I've already seen the worst that humanity can do to each other when it comes to gun violence. Where we are now, we are in a really good spot. Let's just keep the momentum going.
So let's talk about those solutions and what any parent or grandparent or person can do at these different levels, in the home, in the community, in their state legislature, and then at the federal level. Like, what can every parent do in their home to help prevent gun violence?
So I'll answer that in two ways, David. One is just the personal family safety part, and then the other is the policy piece where I spend a lot of my time. So I think just having open discussions and conversations with your family, especially if you have kids, whether you own guns or not. I think that's just something that every parent should talk about is their values around gun ownership, gun safety. Uh, my daughter, she's 13, and like she can just rip off her school's lockdown drills like she's saying the alphabet, which is conflicting. It's I'm proud of her, but it's also disappointing that that's the world we now live in. But at least I know like she is aware of what is happening in the world around her. So those conversations with our family and friends about these values and gun safety is what we should do in the home.
I also think something that's missing in the home, and I'd be interested for your kind of thoughts on this, is there are a lot of communities in the country where kids don't feel safe, or teens don't feel safe, where they're worried about being victimized going to or from school, that they're worried about being victimized at school. I looked at about 800 cases of students arrested with guns at schools last year. The majority of them had no intent of shooting anyone that day, and most of them carried the gun because it was for their personal protection. What do you think that parents can be telling their kids, especially their teenagers, about the consequences of carrying a gun or the consequences of shooting someone, and how different shooting someone is from just having a fight with someone?
Yeah, this loss of psychological safety for our kids in school is, I mean, in many ways for me, it's infuriating that this will be allowed to will be allowed to take root in our country, and we've created an industry for school safety devices. And in the communities where I've worked, I've always been working in communities that are predominantly racially segregated minorities, that are Black or brown, and um, I've always focused on, like, what do we do to reduce community violence, because that involves addressing all the things that intersect to create conditions for endemic violence. And talking to many of these kids, you know, their fear is getting shot on the way to school, getting shot in school, and uh, it's sad that that is their reality. That is their day to day reality, is getting to and from school without getting shot. Most know someone in their family or circle of friends who has been shot. So to address these issues of housing, economy, education that will help communities thrive is where I focus a lot of my effort, trying to bring awareness to these issues that can create safer communities for all of our kids to thrive. Because I think all parents want their kids to feel safe, to be safe, and to grow up to be, live in a world better than the one that we leave the world for them better than one that we are living in right now.
And that's where
And that,
schools need to also be thinking about the community and thinking of the needs of students when they're implementing these different supposed school safety solutions. Because I think
right.
that in addition to kids being scared of getting shot, kids are also scared of getting robbed or getting victimized on the way to or from school. And a response that's happened over and over, it happened in Dallas ISD, is saying every single kid is going to have a clear backpack. Well, if you have a
Right.
clear backpack and you're walking to or from school, or you're waiting at a bus stop, every single person can see what's in your backpack. Every single person can see if you have an iPad or a tablet or anything that's worth victimizing you for. That is displaying everything that you have in a place where somebody might want to take it from you. That doesn't make any sense. So that is a solution that's only implemented if the school doesn't understand the needs of students. In Milwaukee, 2 years ago, there was a shooting on campus at a high school where the kid had the gun in the pocket, the front pocket of his hoodie. So that school district said, we're going to ban all hoodies on campus. Well, a lot of kids don't have multiple changes of clothes. A lot of kids don't have other warm clothes. That hoodie might be the only warm piece of clothing that they have to go to school. So that's a school that doesn't understand the needs of the students, doesn't understand the needs of the community. How do we get school officials to have a closer relationship with the community members, and realizing that those 8 hours that kids are in school is just a tiny part of the day, and anything that they're doing has to be something that resonates with them and matters for like the much bigger parts of their life?
What you're describing is that sometimes our problems, the solution is a hammer, but most times it's actually a screwdriver, right? In a situation like this, you're highlighting the interdependence of different sectors when it comes to keeping our children safe. It is the schools, the teachers, the administration, the parents are involved in that also, but it's also our public officials who are passing the laws that dictate how these schools function. The people giving them the budget to run things, and me also as a doctor. I have to recognize that every patient I see, there's something going on in the community that impacts their health. School being one of them. A lot of my patients, I'd say the majority, the last couple of years have been, school age kids, like younger than 18. So recognizing that we're all doing our little piece. We're just looking at this problem from different angles. We need to do a better job of coalescing our efforts to focus on the same problem to achieve unique solutions. And that's where I feel like someone like me needs to be in the community, because those that are in the community that are closest to the problem often have the best solutions.
Yeah. So then, kind of moving from the community level to the state level, we're 2 weeks from a presidential election. Even a major presidential election only gets about half of the country to come out and vote. People know about some of the high level federal issues, but people don't pay a lot of attention to what's happening at their state level and at their city level. And decisions that are made there around funding, as you said, and funding for gun violence prevention, funding for youth education, state level laws, things like, does your state require safe and secure storage, or can guns be accessible anywhere? Are you allowed to have a loaded gun within reach of you when you're driving a vehicle? That's a state level law that's different in lots of parts of the country. Stand your ground. The law that if you feel threatened in any way that you can shoot and kill someone in a public space, that's a state level law and a state level decision. Within cities, ordinances around where you're allowed to carry firearms. Can they be in any public place? Can they be in an alcohol establishment? These are very, very impactful legislative decisions on either enabling or reducing gun violence. If you let everybody have a gun with no permit and have them in alcohol establishments, you're probably going to have some disputes that turn into shootings. Whereas
Right.
if you require safe and secure storage and hold parents criminally and civilly responsible if a gun that they own is used by a minor, you may reduce your number of shootings. Kind of, what are the things that parents across the country need to be paying attention to on the state and local level?
Yeah, we did pull on that there. That's very important because it's easy to focus on the federal level, but what's happening at the state and local level is as impactful, if possibly not more. And let's talk about what's in Texas, for example. Um, defunding a lot of the public schools in North Texas, where I live. Certain schools are getting shut down and consolidating. So let's think about how funding impacts that. On the other hand, the state legislature has required all schools to have a SRO on site. So you have to find the funds to pay someone who is trained in firearms to protect the children. So it's kind of a circular thing. The schools are unsafe because of permissive gun laws. So let's require you to have someone on campus, and we can go round and round on that. But another thing is, when you talk about the connection between state and local policy, in Texas, if a locality wants to enact any sort of gun safety measure, the state attorney general can actually block that. So the state has said, you basically saying you do not have the authority to make your community safer. And that law has been put to effect by our attorney general to stop municipalities that have enacted laws to try to keep their communities safe. So all that to say is that what you're saying is extremely important. When we're paying attention to our elected officials, pay a lot of attention to what's happening at the local and state level, because that will have a significant impact on your day-to-day.
And then, the issue that we're having around the country and why there's so much disparity in where gun violence exists, because it is not an every city problem in the same magnitude. It's something where, your per capita gun death rates are significantly higher in the South and Midwest. When there are state to state differences, if we want to have truly impactful changes that protect every single citizen in the country, they need to come from the federal level. They need to be top down, because every state then needs to meet those federal mandates. There are lots of ways to make sure states meet those federal mandates. You've been a congressional health policy advisor. You ran for Congress. You wanted to be in there representing the people, being at the front line of this. What do you see? What would you lay out at the federal level that would change and reduce, the prevalence of gun violence in the country?
Well, the first number one policy would be universal background checks. We talk from a policy level, that is number one that can reduce firearm-related deaths in this country. I also want to add to that is that we, as a society, have to recognize that we do not just have a gun violence problem. We have multiple types of gun violence problems. We talk about suicides, intimate partner violence, preventable shootings, community violence. Each have different root causes, meaning they have different types of solutions. So there is no one size fits all. But we can, at the federal level, do a few things. Universal background checks, safe storage.
And
I think we
let's
should
let's
ban.
pause there for a second, because I think people don't understand what a difference safe storage can make. In suicide prevention, we've done a good job around the world at making little steps to make it more difficult for somebody to commit suicide. So things like having pills that you can take. If you take a handful of them, they'll kill you. If you have those in individual little tear-offs instead of one bottle, that alone, making somebody think and take the effort to pop out every one of those pills individually, has shown to reduce the rate of suicide. With bridges, having the nets under the bridges, people don't go to a different bridge. They just don't commit suicide at all. If we put one barrier in the way, it can dramatically decrease the suicide rate, because it gives somebody just one more action to think about. And taking the time to open the gun safe, taking the time to load the gun if the ammo needs to be stored in a different safe. Every one of those steps is somebody taking the time to think, do I really want to do this? As opposed to just taking the gun out of the drawer. Intimate partner violence, the same way. I mean, everybody has been in a terrible argument with their intimate partner. And when things just keep escalating and escalating, they escalate until you have this break. And that break could just be a couple seconds. And in that couple seconds, you think, wow, like let's kind of back this off a second. If there's a gun right there, there's no break. If somebody has to walk to another room, open the safe, think about it. You're creating this time and distance and space. And then with kids, number one cause of preventable deaths in the country for kids is firearms. The most likely age for a kid to shoot themselves or their sibling in the house is 4 years old. 4 years old. These kids don't even know really what the gun is. If it's locked inside a safe, none of those 4-year-olds, there's not a single 4-year-old that's going to accidentally shoot themselves with the gun in the safe. Safe and secure storage can really profoundly impact this problem.
Absolutely. It's particularly in suicide, as you were eloquently going through all the different options there. They've done the studies, and I may get the timing off right here, but the time from someone decides to kill themselves to taking an action, it's minutes, right? And even if you do the pills, that's sometimes reversible, right?
Mm-hmm.
But with a gun, over 90% of those people are successful. And they've done studies of people that tried to kill themselves and that lived. Most of them don't go on to try a second time. So everything you said there about putting a barrier to taking that action makes a huge difference.
Yeah, and just on the suicides for a second, and like, we don't want people to kill themselves. Like that is
right.
That is something we can really do a big difference. And when survivors of bridge suicides have been interviewed, they've been asked, what did you think the second that you jumped off the bridge? And they immediately say, I wish I didn't do this. So there are so many opportunities if you create some time and space to help someone. But what a gun doesn't do is give time or space or a second chance. And that could be the fatal accident, the domestic dispute that turns into a partner killing their other partner, or that suicide when somebody's lost. And once they pull the trigger, there's not going to be an opportunity to come back 90% of the time.
Right. And for children also, like you mentioned this safe storage, and they've studied this as well. For they asked parents who are gun owners, do they think their children know where the gun is or how to get a hold of it? And I can't remember the exact number, but it's the majority. I'm just gonna say, just for the sake of argument, say it's 70% say, oh, my kids don't know where it is, they never handle it. Then they ask the kids, and the majority of them say, oh yeah, I know where it is, I know how to get to it, and I've touched it. So
yeah, the most
parents
recent
think, yeah,
the most recent CDC student behavior survey had a question around could you acquire a firearm, and it was 70% of students said yes. In the surveys of firearm owners, 50% of firearm owners keep a loaded gun accessible in their house. And this actually runs into two narratives, which I think you've probably dealt with. And one is people say, well, this gun violence problem, this is an urban problem with minority teens, and, you know, they've got guns and they're just shooting everybody and they don't care. Well, where do those guns come from? The guns that are in urban areas and the guns that teens have in urban areas are coming from the suburbs, and they're coming from vehicles, and they're coming from homes where they're not secured in those places, so they're easy to take. They're coming from gun shows where you can go and get a gun without any license or paperwork, and then somebody can turn around and sell it for twice that price in an urban area. So it is exactly the permissible gun behavior, kind of the irresponsible gun ownership of not thinking about the consequences of if this gun ends up in a child's hands or someone else's hands, that is the root cause driver of teenagers with guns in urban areas.
Yes, you and I, we take a nuanced look at the drivers of gun violence. And I've had this conversation with, close friends and colleagues of mine, some of the most educated people, and they will just not see it for what it is, right? That there's multiple reasons for the urban gun violence. Within 24 hours of you and I doing this interview, half of the firearm homicides will be young Black men, right? And why you think that is, like, you've asked yourself, like, why is that? Your answer will say a lot about how you feel about gun violence prevention in this country. Because some of my colleagues will just say, oh, these are morally bankrupt people who are just out there shooting and kill each other. Where I see, that is not the case. These are communities where I work. And there are a lot of evidence-based reasons that contribute to endemic violence. Part of it is the supply side, as you mentioned, the ability to get guns so easy in this country. But also, let's look at what's causing the conditions that lead to endemic violence, which have nothing to do with firearms. And we can actually do a lot to reduce firearm deaths that have nothing to do with taking away guns, right? There's a lot we can do that have nothing to do with guns. When you recognize that, you can realize there's a lot that we can do to save tens of thousands of lives through some very evidence-based policies that most people agree we should enact.
Without infringing upon anyone's rights.
Exactly.
Keeping your gun in a safe is probably one of the most responsible things that you can do. And the way that gun ownership is advertised, because remember, guns are products, guns are high profit margin products. The way that they're advertised now is that you're a patriot, you're a protector, you're somebody that cares about America, that cares about your family. Well, the way to do all of those things is to make sure that your kids don't accidentally shoot themselves, to make sure that your gun isn't stolen and then trafficked to somebody that will use it to harm other people, or that in a moment of crisis, either with an intimate partner or a suicide crisis by yourself, that you're not going to end your life in that moment. Those are the three most common outcomes. The chance of an insurgent army invading your house to attack your family is zero. The chance of somebody invading your house and harming your family is extraordinarily small. But the chance of somebody accidentally or intentionally killing one of their family members is really high. And if you care about your family, you need to keep your gun in the safe. And if you don't want to do that, the role of the government is to put in place the safeguards and the checks and balances and legal consequences to make you do that. That's why we have speed limits. That's why we have safety caps on all the chemicals that are in your house. Like we implement things to keep people safe.
Right, and you mentioned the patriots and the protectors. There are some subtleties in there when it comes to race about who we give permission to be protectors and the patriots, and who when you talk about standing ground, who are victims whom we should mourn, and whom are the ones that deserved it. Right, so there's a lot to talk about how racial attitudes have formed our perception of gun violence and our solutions as well.
And that's evident.
One of those,
yeah, I mean, that's evident in the gun industry. If you look at any advertisements, there's a certain type of person that has the agency and permission to carry an AR-15 in public. Oh. And there are others that aren't. And we'll leave it up to the audience to quickly realize what types of people fall into which category. I want to get you out of here on one more question. So we've got this election in 2 weeks. Let's assume that Kamala Harris wins, and as she is filling out her cabinet, your phone rings, and it's the White House asking you to be the Surgeon General. Hey, Dr. Brian, it's plausible. So we're here a couple weeks from now. You've got the call to be the Surgeon General of the United States of America. What are the policy things that you would implement from that office to make meaningful change, both in gun violence, but just in overall health and well-being for the most vulnerable people in the country?
If I got that call, I would absolutely say yes. Probably would not get confirmed by the Senate, but hey, I would I would go take my licks. If I were the Surgeon General, I would center the work on deploying public policy to create communities at the intersection of reducing gun violence and creating health equity. And from that, I believe everyone will benefit from that. We made some, Surgeon General Murphy's made some good strides in the gun violence space with his most recent report. Previous Surgeon Generals have done the health equity piece. I think we're at a time in our country where there's so much more energy and awareness and knowledge of all of the other social determinants that impact our health. I would bring this in with the lens that acknowledges how creating racial equity will benefit everyone. It is not a zero-sum game. We actually all benefit from that, financially, morally, safety-wise. It is a good deal for all, and those are the sort of policies that I would champion were I given the opportunity to be the Surgeon General.
Absolutely. And then I think just to kind of bring this conversation full circle, there are incredible things you could do for the federal level. But as people go to the polls, you've got to think about what your state and local elections are going to do in terms of the policies that are going to have a direct impact on your everyday life and in your community. And then within the community, within schools, within your home, these are discussions that you need to have. There's an opportunity for every adult in a community to be a positive influence on every single child and teenager, to talk to them about their fears, to talk to them about the consequences of carrying a gun or shooting someone, and then just understand what they need. I mean, kids need role models. Kids need help. Kids need adults who care about them. But if you made it this far in the podcast, we've got a very special offer from Dr. Brian. If you like, share, subscribe to this podcast, leave a comment, Dr. Brian Williams will send you a signed copy of The Bodies Keep Coming. So make sure that you do that. And where can people find you? Where can people find out more about you before you're Surgeon General? Because then we'll all know how to get to you.
Well, my website, brianwilliamsmd.com. I spell Brian with an I. And if you go to that website, it has all my social tags. I'm most active on Twitter, but you can also find me on LinkedIn, little bit on Instagram, but the best ways to contact me are through my website, brianwilliamsmd.com. Email through there as well. And you can follow me on Twitter, probably where I'm most active.
All right. Well, thank you very much. This was an important discussion. And unfortunately, this is something that we'll probably talk about again in the future. Thanks so much for coming today.
David, thank you for having me.